Barcelona, IVF is a vocational project founded by a group of professionals feeling the need to recuperate that traditional medicine without having to sacrifice the latest advances in the field of the reproduction. Our goal is trying to offer the best diagnosis test in a friendly environment, making sure that patients have really friendly and comfortable stimulation protocols. We try to work out the best solution in an individualized way, making sure that each patient has what she needs. Furthermore, we have a state-of-the-art laboratory with all the latest advances like MC, blastocyst culture, embryoscope, in order to seek for the maximum chances of success for each couple. But it's not just a matter of equipment and techniques. We have a multidisciplinary team that includes embryologists, gynecologists, andrologists, psychologists, nurses, and really professional staff that is with a vast experience in this field that are always very well trying to deal with any problem that patients might have. The idea behind this project is not just to be successful. I mean, the results are important, but what we want is the patients feeling accompanied and feeling that we are going to be with them throughout all the process. So this is a very emotional road, very winding road sometimes, and we think that if we support the patients, if we prepare everything to make this winding road more comfortable for them, everything should be easier. Sterility is when a couple that has been having regular sex for 1 year does not get the pregnancy. And infertility is related more to what is called the recurrent pregnancy losses or recurrent miscarriages, patients that are able to get pregnant, but then this pregnancy does not go on. Both infertility and sterility are much more common nowadays. The main reason is the advanced maternal age, basically due to women delaying their maternity because of the professional career. Also, other aspects like environmental toxics, smoking or alcohol, drugs, sexually transmitted disease may also be increasing these problems. So probably in the near future, more than 25% of the couples are going to have some problem in this area. As regards to the factors that cause infertility, I would say that female factors are much more important than male factors. I would say that 60% of the problems belong to the oocyte and may involve poor quality, poor responses and things like that. Male factors are probably 30% of the reasons of infertility, with azoospermias, which means complete absence of spermatozoa in the semen, or low counts or problems with motility. And then there is a small pool of 10% of reasons that are due to problems with the uterus, polyp, fibroids, and things like that.
The solutions for infertility depends on the diagnosis made on the patient. We have very different treatments, and it depends on what is the problem of the couple that we are going to solve with one treatment or another. For example, if a woman has an ovulatory problem, so she does not produce eggs each cycle, we need to induce the ovulation. And this is a treatment especially recommended for young women. Then we can go for another treatment a little bit more complicated, like IUI, in which the idea is to induce the ovulation once we have confirmed that the tubes are open, the tubes are fine, and the sperm quality is good enough. This is especially recommended when we have a woman younger than 35, 37 years old, with all the studies of infertility good, so no problem of infertility. Then if we move another step more, we go for IVF. IVF is recommended when the sperm has low sperm count, so cannot achieve a pregnancy easily with no help, or if the woman is older than 35, 38 years old, or for example, if the couple they have been trying to look for a pregnancy for more than 2 years, so we cannot help them with IUI. Or if we have tubes problems, so if the tubes are blocked, we are obliged to go for IVF. In the last step, when the eggs of the patient are not good enough to work with, or they have tried but we cannot have embryos of good quality, then we can recommend egg donation. In this option, the idea is that a younger woman is going to produce the eggs for this patient because their eggs are not useful enough. Egg donation in Spain is one of the most popular treatments because regarding to our law, we have lots of donors and the anonymity protects a lot the patients and a lot the donors. Out of 10 patients, 9 patients, they are going to achieve a pregnancy after several treatments, but the idea is that we try to do the best to achieve the magical dream.
I'm a patient assistant here at Barcelona IVF, and what we do in this department is we take care of the patients that come from abroad, from all different countries in the world. We take care of all their needs and their doubts are solved. So we are in between the medical team and the patients. So we get all the emails and the phone calls, and if we can solve the problems ourselves or the doubts, we do. If not, we talk to the doctor and we give them an answer as fast as we can. The patients sometimes get very stressed. So if this is the case, they can talk to us and we try to give them some advice and to listen to them, which I think it's special here by Barcelona IVF, that each patient has a patient assistant taking care of them.
I first came in contact with BCN IVF and Dr. Oliveras back in 2012, and I found out about this clinic actually through a fertility chat forum. They had very good reviews, there was a lot of good client feedback, so I decided to contact the clinic personally to set up a consultation and see for myself what they were all about. Overall, just right from the beginning, the experience has been very positive. It was a very personal experience. It was a very family type of feel at the clinic. I felt comfortable asking them as many questions as I had. I've had a really positive experience with BCN IVF in Barcelona and with the team of Dr. Raul Oliveras and his medical assistants. So I would have absolutely no hesitation in recommending that clinic and recommending his team.
I'm trying to be with the patients, with the couples or the persons who need my help, because sometimes doctors don't have enough time to be with them and explain all the things and take care about the feelings of the couples and this kind of emotional things. They don't know what is happening sometimes. They need to talk, they need to speak, they need to explain what they are feeling about all these things. And sometimes they feel things and they don't know how to do with that emotional things. Psychologists in fertility clinics, we are new. It's really important. Couples need our help. I mean, need the counseling and need to speak about problems, speak about all the emotional issues, and they need a person which is who is specialized in this kind of treatments, who can comprehend, who can understand all the things they have.
Barcelona IVF has a lot of advantages. We are placed in a very big city with a very easy access from different parts of Europe and UK with a lot of flights. We have a really professional staff with vast experience, very well trained. We have a state-of-the-art laboratory with high results. But I would say that our flag, which really defines us, is this way of understanding the medicine, you know, that each patient is going to have their own doctor, own patient assistant, someone who is going to be there 24 hours a day, solving problems, explaining doubts. We have a really good results. I mean, we have a lot of people, but what we think that we can tell is that we have the happiest patients in Europe.